Hey guys, Dr. Jake at Fortitude and Freedom. I'm going to show you a hip mobilization that I use in my practice quite a bit. Actually learned it from a colleague of mine, and it really works pretty well. We do the same thing with bands out in the gym, but this is a manual technique that gets a lot of overpressure and stretches the outside of the hip. So when I bring Michaela's leg up here, she gets some impingement up in the front of her hip between her femur and her pelvis. And so that tells us that the hip joint is restricted, and just like the shoulder, the ball tends to ride up forward into the socket. What we're going to do is glide it down and back. So what I'm going to do is put my chest on the top of her knee. I'm going to hang on to the end of the table here, and I'm going to drive that femur, kind of driving that ball down towards the table, out and back, to get a stretch on the back side of the hip joint. Feel that stretch there?
Mm-hmm.
Okay. Every once in a while, they might get a little bit of impingement up in the front or inside of the hip. So another technique would be coming onto the same side and driving straight down, and then adding in some rotation. You feel a similar stretch there?
Yeah.
And I'll also use a belt around my waist and around the hip, which I've done posts on in the past, which pulls the femur out of the socket this way. Then we can glide that femur downward without catching the pelvis or without catching the socket, which makes it a lot more comfortable. But what I see in the gym and in athletes is hip tightness, hip restriction, which tends to lead to impingement up in the front of the hip, just with this test here on the table, but also they get impingement with squatting, and they get backwards pelvic tilting or butt winking at the bottom of their squat, which oftentimes leads to lower back pain and lower back issues. People with stiff hips that don't hinge from the hip as well tend to dump a lot of exercises into their lower back as well. So if your back is sore after deadlifting or sore after squatting, the problem might not be in your back, it could be in your hips, and becomes a mobility issue and maybe modifying some technique. So check your hips, check your mobility, and if you got stiff hips, stay tuned and we'll show you how to mobilize it with bands.